Our next expert is Dr. Krishnamurthy, who will speak to us about diabetes and how it impacts heart health.
Hi, I am Dr. Krishnamurthy. I'm one of the family medicine doctors practicing with DMC for the last 3 years. I'm here to talk about the diabetes and its impact on African American community, especially during this COVID times. I'm aware that in the midst of the COVID, everybody is scared to come out of their house to visit the doctor's clinic to take care of their own health. But at the same time, I'm here to say that diabetic is growing as an epidemic. It is growing so fast. Every 17 seconds, someone in America is getting diagnosed with diabetes. With that being said, the risk of diabetes is 77% higher in African American community than in a non-Hispanic American. So with that being said, how can we prevent this and how can we detect this earlier is what I am here to talk about. At least 68% of the people aged 65 and older with diabetes die from some sort of heart disease, and 16% of which they die out of stroke. This number is really high. So diabetes and heart disease go hand in hand. You would have heard a lot of people say diabetes is making you more prone to cardiovascular. What do you mean by cardiovascular? Cardio means something related to the heart. Vascular means something related to the blood vessels. So cardio means like the heart and the heart-related conditions which comes from the diabetes, making the blood vessels or the blood supply to the heart, which is much more harder. That means the heart is not getting enough blood supply. When the heart doesn't get enough blood supply, that's what it leads to what's called as a heart attack. And vascular means something related to the blood vessels, which is the blood vessels to your legs and feet. Peripheral arterial disease may be the very first sign that a person with diabetes have. And CDC says you are twice more likely to suffer from heart disease and stroke if you have diabetes than a person without it. So however old you are right now, you can start to control your blood sugar. So diabetes means you have excess blood sugar in your body. So excess blood sugar can be either type 1 or type 2. Type 1 means the insulin, which is the hormone which converts your blood sugar to an energy form. It's either the type 1 which you don't have it, or the type 2, you have that insulin in your body, but you're not able to utilize it properly, which is the most common diabetes, which comes with what's called as obesity, meaning if your weight range is in the higher end, the insulin which is in your body is not able to utilize this excess blood sugar. So this causes hardening of the blood vessels, causing the blood clots to happen in your heart, ultimately leading to what's called as heart attack. And you might say, hey, why is this heart attack more common with the diabetics? Because undetected diabetes happens to cause what's called as a nerve damage, or also called as neuropathy. When you have it in your hands and feet, yes, you can say, hey, I'm having tingling, I'm having numbness in my fingers and my toes. But whereas when it happens in your heart, you don't feel the chest pain. Imagine how scary it would be. So you're having a heart attack and you're having a pain, which means you're having a silent heart attack. You would have heard lots of people say, hey, he's a little older and he died in his sleep and there was no sweating, he's not having any pain, he's not complaining, he went to bed and all of a sudden the next day morning he woke up dead. And this is the most common cause. Diabetes causes neuropathy. How do you prevent diabetes? I would say start working out, meaning you don't have to go to the gym. I understand in the midst of pandemic it's so hard. So being active, American Diabetic Association says 150 minutes of active exercise in a week is good. So 150 equals to 30 minutes a day, 5 times a week. So 30 minutes you can walk in the basement of your house, in your living room. 30 minutes of brisk walking is all that is needed. And stay away from junk food. It could be potato chips, it could be cakes, muffins. If you stay away from them, you are putting less sugar into your body. And start eating more raw fruits and vegetables, which would help you to increase your metabolism. One simple check that you can do it at home is your waist measurement. In using a tape, you can point at the maximum waist level that you have, and when you measure it, if it is more than 40 inches in a male and more than 35 inches in a woman, it is considered to be a high risk for diabetes. So at that point, I would say, please come to the doctor's office and check yourself right away for the A, B's, and C's. A is the A1C. What do you mean by A1C? A day you eat a cheesecake, your blood sugar can be in 400s. A day you eat a salad, it could be like in the hundreds. So any number between 70 and 200 is considered to be okay. But how do we know? How do we know how averaging your blood sugar is? And that is a magical number called as A1C, which you get it from a blood draw at the doctor's office. So it is a 90-day average. 90-day average of your blood sugar in your body measured between the numbers of 4 and 6 is considered to be the A1C. So get that checked right away. When you go to the doctor's office, you also get checked for blood pressure. Diabetes and blood pressure go hand in hand. So get your blood pressure checked right away. And using the blood work, we can check your cholesterol as well. So there are your A, B, and C. A1C, blood pressure, and the cholesterol. And the last but not the least, stop smoking. If you are, stop smoking and do not pick up the smoke ever again. And these are the simple tricks that I would say to stay away from heart disease and stay away from diabetes eventually. By practicing these A, B's, and C's, and by stopping smoking, I would say you would stay away from diabetes, and henceforth you would stay away from the heart disease. And thank you for your time.